I'm a trauma critical care surgeon from Savannah, Georgia. I work at a level 1 trauma center. My other, quote, half-time job is the Chief Medical Informatics Officer. We're the only trauma center for about 35 counties in southeast Georgia, so we're very busy. We're a tertiary referral center, so we get a little bit of everything. First of all, the first step is understanding what the requirements are, and there are some challenges there. And we, obviously got engaged through the website, various webcasts, seminars, vendor information to first of all get our hands and arms around what really the requirements are and what they really mean. So step one is getting your hand around what do I need to do to meet or to test for meaningful use. And once we did that, then we sat down, we had to survey our own EMR. We had to look and see where the deficits were. And then in conjunction with our vendor, we were able to come up with a strategy in order to test for meaningful use. Well, the most valuable is a dedicated team for meaningful use. We, hiring or repositioning some of our IT staff, some of our nursing staff to help come up with a transformation plan, and it is a transformation for the hospital. So we've had to get those folks on board, train them, and then come up with a strategic communication plan with deadlines. And working with our CFO, CMO, and CEO, we're able to sit down and come up with a plan and say, if we want the money this year, it's X dollars. If we want to wait till next year, we can do it. But the money may not be there may not be as many dollars there, or we will get the money sooner if we put more resources on board. Do your homework. Clearly understand what the meaningful use objectives are. Make sure you clearly communicate that to all personnel, all levels of providers in the hospital. Change management is hard, and you've got to communicate extremely clearly to everyone involved what the expectations are, what the timeline is, and why we're doing this. And it won't be perfect on day one. Meaningful use is a good start, but it's not the end. It's kind of what I consider the very basic requirements, because as physicians, we want a lot more than just what meaningful use is asking us. I think the incentive program has done several very positive things. It kind of forces hospitals to spend the money to finally purchase or migrate towards the electronic medical record. And I think we would have gotten there. I think the incentive program just has accelerated the process. This is the beginning. We're just really stage one. We're just laying the foundation to try to get things in gear. Stage 2 will have a bigger impact, and certainly by stage 3. As a trauma surgeon and CMIO, I'm very interested in patient safety and quality, and I think that's where the real benefit for those things are going to come in stage 3. The young and computer-savvy patients, for the most part, are very interested in things becoming electronic, because patients want to participate more in their health care, and by making the the medical record available in electronic format, which means we can share it with them, they can see their data. They may not always understand it, but at least it allows them to begin to start participating and taking ownership of their own health care. This is a beginning, because it's their data, it's their information, and we need to make it readily available to them, explain to them what gaps they have in the information, and say, hey, your cholesterol is good or bad, or your, somebody is diabetic. We can say, hey, your blood sugars are well controlled, hemoglobin A1C is too high, too low. So it gets them engaged, and at the end of the day, I think they understand that this will make things more transparent, And eventually, by stage 3, it will improve the quality of patient care as well as make things safer. And again, the most important thing that's going to come through all this, I think, is better coordination of patient care. It will allow us to do things more efficiently and hopefully reverse this exponential increase in medical care. We all want more for less. We're going to have to learn how to provide higher quality care for less money. And I think the EHR is going to play a pivotal role in that.